Welcome back to another episode of the Huxley Morton Podcast, the show where each week I'm bringing you both personal and professional stories from company owners, innovators, and industry leaders all working in the world of clinical trials and healthcare. This week, I'm joined by Matt Miclette, the Director of Operations over at NeuroFlow. Matt, welcome to the show.
Yeah, thanks, James. Pleasure to be here.
You are very much welcome. Well, look, I guess NeuroFlow, that's the name of the company. But look, tell me, I guess, a quick introduction from your end. Who are you guys? What do you do? What is NeuroFlow?
Sure. There's nothing more I'd rather talk about. So NeuroFlow is a digital mental health company. And, I think traditionally when people think about mental health companies, maybe you think about like a Headspace or a Calm or kind of some of these self-management tools, right? Consumer apps.
Mm-hmm.
But really what we're trying to do is to help integrate behavioral health and mental health solutions into physical health settings. So,
Right.
What you can think about, we do that really in three ways. So the first way we do that is through measurement, right? So helping particularly PCPs and their co-located staff in order to track behavioral health outcomes over time. So that can be things like validated health assessments. Those that are physicians or healthcare providers on the call probably know things like the PHQ, which is a depression screening and assessment, or GAD for anxiety. But we can also use other things like subjective metrics. So that can be like, how well are you sleeping? What is your mood like? How is your pain? Right. And then also being able to take more and more passive measurement, like things like wearables. So being able to look at like step count. And I always think step count's super interesting because you can think about depression where somebody is very depressed, their step count's probably going to go down quite low, right? Probably near zero, versus somebody with like cocaine use disorder, right? When they're actively using, their step count might be way up. So being able to kind of use this more passive information to pull in to also help with kind of our risk stratification. So we actually take all that information. And that kind of goes to the second thing of what we do, which is to help really manage that population. So taking all this information in, more data is not better, but being able to then consolidate it in a way that's usable. So creating kind of a risk profile for each patient, and then also providing treatment recommendations back to clinicians where, hey, my patient has an elevated depression score over the last few months. What can I do about it? And being able to help them and provide them some insight. And then the third thing we're doing is then really engaging the patient or the member, depending who you're working with. And, we know there's a lot of evidence-based treatments and protocols to help patients feel better, but if they're not doing them, then they're not going to get better. So really working in engaging ways, including using behavioral economics, where we're actually providing rewards for patients for doing the right thing. And through all that and connecting this in a feedback loop where there's a patient mobile app that connects back to a dashboard, which then feeds into the EHR so that the provider doesn't even have to go outside the EHR to be getting these insights and really being able to drive care. And ultimately, one last thing too, is then we can then use that to deliver some of these evidence-based delivery models like psychiatric collaborative care, which we can help staff as well.
So look, it's all very much mental health focused, improving people's mental health, tracking people's mental health, and I guess monitoring certain behaviors, habits that all contribute and are affected by an individual's mental health. You mentioned a couple of letters at the end there, EHR. I think it was one of them. Look, for those of us that are, I guess, not familiar with that, what does that translate to?
Sure. Yeah. So that's the electronic health record, right? So that's where I'm going in and actually doing my documentation as part of your healthcare team. And traditionally we ask a lot of our physicians, particularly here in the US, with a 15-minute visit. They have to do a lot, and we can't have them going to multiple different platforms and multiple different software to be able to do this. So really the home where a physician wants to stay is that one health record. So being able to feed information into that is really critical and something we found is essential in working with in this setting of physical health.
Sure. Okay. So look, you've given us an overview of what you guys do as a company. You mentioned that there's an app in there. Is that what you would physically class as like the NeuroFlow product system? Or is there more to it?
Yeah, there's more to it. Generally when I talk about NeuroFlow, I kind of refer to it as a platform because
Uh-huh.
there's really two sides to it. So there is the mobile app. So there's a NeuroFlow app. So you could actually go onto the App Store or Google Play and download it. You couldn't use it without an invite from your provider,
Uh-huh.
but you can check out the awesome reviews because we have like 4 and 5-star reviews.
Incredible.
And what's great is then everything that's collected on that mobile app is then fed back into a client dashboard, or a provider dashboard.
Yeah.
And the term that is often used for what we're developing is a functional registry. So it's a way to basically manage a caseload. So I can quickly look and go, hey, who out of my patient population is the most at risk? So I can then focus on those individuals. So we're able to really quickly kind of look through that caseload flag. I can add flags so I know who I want to go back to and check in on. I can track the time I spend with them, which is really important, particularly in the US with billing codes and kind of meeting requirements and documentation requirements.
Yeah.
So it's really those two sides. And then that information then also feeds into the EHR.
I see. So look, I guess in terms of that also, you're talking about providers, patients, who I guess would be the providers, who is your customer base for NeuroFlow?
Yeah, so we really sell to a few different segments. One being kind of independent medical groups. So you can think about like providers and physicians that are really interested in integrating mental health into their practice.
Yeah.
There's a lot of reasons why they want to do that. One is providers care, and we know that there's a huge link between physical and mental health, right? So the other reason is there's a lot of billing code and reimbursement opportunities here for them. So we sell that to them, so directly to physicians. We also sell to health plans. So we have a couple different ways that we work with health plans. One is kind of as basically a care management tool and population health tool, where we're able to identify those that have social determinants needs, or maybe have these mental health needs, and can flag them, identify them, and push automatically resources to them. And then also being able to, again, do these delivery models with payers. And payers care so much about this. So because of the incredible costs that mental health has. So somebody with diabetes is 2 to 3 times more expensive if they have a mental health condition compared to somebody who does not. And that is a staggering number, right?
It is, yeah.
So being able to treat these mental health conditions is a really important for the payers. And then our last segment is with the government. So we actually have contracts and work with the U.S. Air Force and U.S. Space Force and the VA as well. So very similar use cases to our commercial segment, but really making sure we tailor that experience to a service member or veteran.
Sure. So look, I guess where does the technology side of things come into it? So how does it all work? I guess the data has to come from the patients. How do you, how do you get people to enroll in this and actually give you that information? Because I would imagine that, mental health is one of those things, isn't it? That, part of it is that people just don't always speak up. So how are you guys managing to grasp, this audience in order to get the data to then provide to their physicians? Talk me through the actual the workflow process that someone would perhaps go for. How do they filter into you guys? Sorry, there's about 1,000,001 questions there. It's because
that's a great question, right? And I think that's a really fair question. Like, why the heck would I want to give these guys my really personal info, right? I think mental health is still really stigmatized in terms of like how we value that information, right? As an individual. So to answer your question, there's a few ways. The highest engagement that we see is when it's introduced by the actual patient's provider. So when it's their physician or nurse practitioner or PA, whoever it is that's working with that patient, says, this is a really valuable tool that is going to help me do my job. When we have that connection, our registration rates, are 70-80% of people signing up. So it's
that figure of authority, isn't it? Your physician says, look, this is going to help you. Naturally, you're more inclined 100%. To say, okay, let's give it a whirl. Even if, you're not used to using app technology and, you haven't heard about this sort of thing, you're going to say, okay, perfect. So I can see why that is where you get the biggest uptake.
Yep, that's right. That's right. And when we do these more population rollouts where we make it really easy, which is really important to do. So if we send out kind of a text message to James, right, and James gets this text message on his phone, then it's all about messaging and marketing, right? So it's not going to say, hey, NeuroFlow is inviting you to this. It's going to say, hey, your health insurance or your employer is inviting you to this. And then if we can then precipitate that with some marketing materials to let you know this is coming, this is why we're doing it, this is how your health is protected. So there's a lot of marketing that we really work on before we launch this out. So patients or members really know to expect this and why it's of value. So again, very similar kind of rationale to the provider giving that information. But if you can really let them know how important it is and make it super simple. It has to be as seamless as possible to sign up.
Same as anything in life. Certainly the Amazon one-click world that we live in now, it has to be that easy. Otherwise, people just lose interest.
That's right.
Okay, well, look, that gives us, I guess, a bit of an overview as to NeuroFlow, how it works, etc. But let's come on to yourself, a quick rewind as to maybe how you got into this and where the idea came from.
Sure. Yeah. So, interesting backstory. So our CEO and founder, Chris Malero, and I have known each other for quite a few years. And it's funny because it's one of these kind of real acts of fate, because we actually crossed paths so many times without realizing it before we met each other here in Philadelphia. So we were both in the Army. So I was treating combat trauma, and then I also led an inpatient psych unit down at Fort Hood, and which is in Texas. Both Chris Malero and I were at Fort Hood at the same time and actually never met each other there, but we overlapped.
Didn't bump into each other, didn't know each other's names, didn't even know each other existed.
No idea who Captain Malero was at the time. He didn't know who Captain Miclette was at the time.
Would you say that, I guess looking back on it now, do you ever recall seeing his face around camp or anything like that? Or
no, I mean it's a pretty big place, right? Like it's kind of like seeing somebody in like a medium-sized city, right? Like it's probably like
okay, fair enough.
Yeah, like 70,000 people or something like that there. But what's really interesting is my job at Fort Hood was to really run the inpatient behavioral health unit, right? And at the same time, why NeuroFlow was founded was Chris's experience at Fort Hood, where he came back from a deployment, and a soldier of his that he knew really well, he's the godparent to his children, completed suicide. And what led to his suicide was really a lot of gaps in care, where he was identified as having depression. He was somebody with chronic pain issues, which there's a lot of overlap between chronic pain and depression and suicide. And he was referred to behavioral health. He was given a script for antidepressants. He never followed up. He never went to the behavioral specialist. He never filled that script. And he was lost to the system, right? And that was kind of Chris's mission and passion when we both went to the University of Pennsylvania for grad school. Again, like didn't even meet at grad school either. And that was really what drove him to found NeuroFlow.
Okay, so look, you guys met or didn't meet, as it may be, at Fort Hood. You then both ended up going to the same grad school, where again you didn't know each other. But tell us, I guess, then how the mission came about.
Yeah, so I actually started a doctoral program down at Johns Hopkins, and I was having a beer with Chris one night because we've at this point we both were nonprofit founders. So this was after kind of grad school. We both founded nonprofits that I still run today. I'm executive director of the nonprofit Action Tank, and Chris was really integral in helping me set that up and running that and determining what our mission would be. So we're having a beer one evening, and he's talking about NeuroFlow, which had been around for about a year at that point. And really,
when was this? So that was about a year. Chris was a year in at that point. When are we looking? How many years back are we talking now?
Yeah, so this is 2018. So 2018. NeuroFlow was founded right around beginning of 2017. So I wasn't one of the original core team members. But when Chris and I talked about a year later, it was really when he started to shift from being this tool for therapists, which NeuroFlow was originally developed to be, to more of this integrated behavioral health tool that I'm talking about today, and really needed help to understand, like, how do we demonstrate that sort of value? And that's what I was studying in my doctoral program, which I found to be really slow. And I also was working on some state level and local policy, which is also really slow. So when Chris kind of said like, hey, I think there's a role for you here if you want something that's more fast paced. And that was really when it like clicked that, you know what, we have a real opportunity to work together. Chris is an amazing human that's so driven and mission driven that I couldn't resist. Right. So then I had the opportunity to join
synergies were there,
Yeah.
you both similar mindset, both similar background, and it just seemed to align from that point over a beer, as so much does.
That's right. That's right. I always I have a good friend of mine who always says like breaking bread with somebody, right? Having a meal with somebody, you can't replace that. Right.
Yeah.
It's just, it's a very intimate setting. And that's what it is for me too, is sitting down with somebody, having a coffee, maybe instead of a beer, right? If it's in the morning, is always how I found that deep connections are formed.
Most definitely. So look, that's I guess how the idea came about, and I'm guessing then that a lot of it was perhaps driven by the fact that you were both working with, I guess, military or Air Force based organizations, and it's notorious in those sort of establishments that there's a lot of mental health issues because of the work that is done. So that must have been quite close to your heart as well. So, from there, it's, we're now 2021, things have progressed on. Give us a snapshot of how things are going. How many of you were there, when you joined and took Chris up on the offer for something a bit more fast paced, as you said?
Yeah. So I was prior to being number 20. So I was something like employee 16, and now we're over 60 employees post Series B. So I joined just before Series A. So we were still in seed round. Now we just closed Series B at the end of 2020 with a lead investment from Magellan, which is a large behavioral health company here in the States.
Fantastic.
Since then we've been growing. We have a lot of more roles to fill. So we'll be far surpassing 60 here shortly.
Wow. How's that changed for yourself? Because like you mentioned, some of the work that you were doing was quite, slow. You then moved to something fast paced, and it seems like it's perhaps picked up. Your role must have changed quite a bit, so you're the director of the clinical operations. How has your role changed from, say, day one to what it is now? What are the best bits? What are the worst bits? And what are the biggest sort of changes that you've noticed since joining?
Yeah, I think, it's a really interesting question. I think what hasn't changed is that every day is different, right? And that's like my favorite part of the job, is that there's no day to day for me, right? But what has changed is really building out a staff, and a staff that I truly love to work with. So being able to not just be the operator on the ground, but setting that strategy, right? And helping to prioritize and really thinking not just like about next week and how do we stay alive, but now that we have the runway for years, it's much more thinking about the long-term strategy of what we're trying to do and building things for the future, which is so empowering and really makes me enjoy my job quite a bit. So I'd say that's the biggest thing. And knowing that, since 2020, we've 50% of our team has been onboarded remotely. So you think about what that does.
How have you been impacted by, because if you've grown that exponentially, how has it been affected with remote onboarding? Because as a recruitment business, ourselves, we know that there's often struggles with remote onboarding and training. And, going back to what we said before, often sitting down and having a beer or, a meal with people, or meeting the team, historically has always been come in, let's get together, maybe, there's a full introductory session, whereas now it's not quite the same. So how have you guys managed to adapt and deal with that and, continue to grow?
Yeah, I mean, we put a lot of focus onto the onboarding experience and what that's going to be like for somebody. So, really having a very standardized way of where we make sure that each individual is meeting all the department heads. So, yesterday we had 2 new hires this week, and I sat down with them and talked about what is clinical operations? What is my role? Like, when will you want to come talk to me? Right. And really making it clear on who each individuals are. And then we still have a lot of fun, right? So we had a virtual escape room the other night, which, I thought was going to be lame, I'll be real. And it was incredibly fun. So, where we used to go out and kind of have happy hours or at least go out, we used to go bowling or things like that as a small team pre-pandemic. We're still finding ways to get together kind of after work and socializing and seeing like what motivates each other, right? Because I think that's really important to know as a coworker.
Yeah, and I guess normally, yeah, when you're office based, you get that around the water cooler or at lunch or after work, etc. Whereas it is different remotely. I mean, how are you guys? I guess at the moment, are you still fully remote? Are you part office based? Are you running a hybrid system? How is it for you guys?
Yeah, so we're basically optional right now for our office. So I was in the office yesterday. I'm also fully vaccinated, which is great. So right now it's optional. We're kind of making our back to work plans now. It'll probably be some sort of hybrid where
Yeah.
a few days in, a few days out. I think people have found that they like working remote at least a couple days a week, right? I think that's been the biggest change since the pandemic. So I think there will always be some element now of trusting one another to work remotely, right? I think it takes trust to be able to do that. That what are you doing when you're home, right?
Yeah.
But I think with the amount of amazing work we've done over the past year, I think there's no question that people can work from home and do it effectively. But also understanding that when you
Definitely, everyone that I've spoke to has said exactly the same. It's kind of like, the days of having to watch over staff are kind of dead, and the pandemic has proved that. And everyone, prior to COVID was talking about, oh, we should be doing a 4-day week, 3-day weekend, etc. And look, it's not necessarily that. It's just having that flexibility, I think. And I've found that a lot of people are getting more out of their employees just by sharing that trust effectively, as you've said.
Yeah, it's particularly working at a high growth early stage company, right? Where you're traditionally probably going to have a bit of a younger employee count where they're just starting to have kids and just starting to have a family, right? And they having that flexibility when you have a 6-month-old at home, where maybe you need that a couple hours in the middle of the day to do some work, but knowing that you have that flexibility to come back later in the day and still get your work done, right? Because ultimately that's what matters, is just making sure that your deliverables are done on time.
Yeah, exactly. I guess it's the results and the deliverables rather than the time input, and that's what I think a lot of people have overlooked previously. But I guess even still, there's perhaps been a lot of challenges because things have changed so much in terms of systems, how we're communicated. What would you say has perhaps been the biggest challenge for you, maybe personally, Matt? What have you learned about yourself during this crazy year that we have all experienced?
It's funny. I always used to say, like, I'm really good at being an extrovert, but I'm really an introvert. And it's not true. Like I've been realizing, like, I feed off the energy of other people. So, when we're going months at a time without seeing a coworker, it was draining for me. And really seeing like how much it matters to me just to be around somebody and talk about not even necessarily work, but just being around coworkers and just talking to them, how much that makes me excited and wanting to be part of a team. So I think that's what I've learned about myself a lot is it's just how much these personal relationships really mean to me in person, and how much I need to make sure I continue to use that to my advantage, right?
So are you going to be one of the ones who's taking the opportunity to get back in the office? Are you going to be there knocking at the door?
Yeah. I mean, like I said, I was in there yesterday. I think, again, like being fully vaccinated now certainly changes my outlook quite a bit. But yeah, starting to go on a little bit of traveling again. We're going to be going down to an Air Force base down in Florida next week. I'm just super excited to be able to, break the monotony of the house, right? And the house living and start to feel excited about what we're doing, which I'm always excited. Don't get me wrong, but to feed off that excitement of other people is really what motivates me.
Okay, look, I guess I think I'm kind of the same. I guess, look, we're a remote business now, but I massively miss that office environment to an extent, and it's something that we're going to look at and bring in perhaps a hybrid system moving forward, because even now in the UK, going out and about where restaurants and bars have started to open, I'm walking through the town, often walking my toddler through, and I'm looking in and I'm thinking, I hadn't missed this previously, but now I do. Oddly, it's just a strange feeling. But look, what are the plans for both yourself and for NeuroFlow moving forward? Is it continued growth? Are you looking at additional offices? How what does the future look like for you guys?
Yep. I'll start with office space. That's an easy one. So we need more office space. So we are moving to a new same building, which is great. We are literally a stone's throw from Independence Hall. So being able to be like right where our country was founded, right? Like kind of weird talking to a guy from UK about that, but but in terms of the company, we are specializing in delivering the psychiatric collaborative care model, which is basically the most proven model for integrating behavioral health. The problem is it takes a lot of staffing to be able to do that, or at least perceived to be a lot of staffing to do that. So we're actually partnering up with some really great telehealth partners like Magellan, who have a tremendous skill in delivering licensed social workers and psychiatrists, and bringing this complete solution to health systems to be able to deliver this model where previously it was impossible. So, my dream and my dream for NeuroFlow is to make it so that psychiatric collaborative care is something that's easy to do, something that's easy to deliver, and that patients will incredibly benefit from. So scaling up this model that has 20 years of evidence nationwide is not just the company's dream, it's like my mission, because it's something that has to be done, because there's too much of a shortage of behavioral health providers right now to meet the need.
Sure. Well, look, that all sounds very exciting. New offices, new staff, more hopefully patients that you're able to improve mental health for. I guess, look, just to rewind a little bit, I'm just thinking about patients and what you've just explained there. How does it work with sort of patient physician confidentiality, etc.? So if it's via an app, is it all into one portal? Is it encrypted? How, just fill me in on
all the data is encrypted in transit and at rest. Right. So we're on Fed compliant, which is a way we work with the government, Fed compliant servers with AWS. Right. So, our security is pretty top notch. To work with the government, it has to be. And, HIPAA compliant, all the things you'd expect. I think it's not so much actually doing the security, which is certainly our engineers' job and like their priority number one. But how do you express that we're secure? I think is honestly the bigger challenge.
It comes back to that thing where you mentioned earlier. It's that's the marketing, isn't it? It's that communication.
That's right. I could tell you that all day. We how we use REST APIs, and our data is encrypted when it's in transit and at rest. But like that doesn't mean anything to an airman in the U.S. Air Force, right? So to them, where we get a lot of credibility from is talking about people we work with. So that's usually what I do when we roll out with the Philadelphia Police Department and Fire Department. I'm talking about our work with the VA and how veterans are using us today, right? And they can trust us because we're doing this work already. So that's usually when I talk with patients, that's usually the messaging that I use.
Sure. Well, it sounds like an incredible platform. The fact that you can monitor, people's moods and help to improve them by assigning tasks, etc., all via your app and your online platform, etc. It's pretty incredible. So look, I hope that there is lots more to come from you guys. But look, to give us a bit of a summary in terms of what's next, the new offices, etc. Is there any new applications or anything like that you're going to be bringing out? And also, what are you going to be looking forward to, Matt? I guess on the personal front, post lockdown, it seems like we're getting a little bit of light at the end of the tunnel, aren't we? So, what are you looking forward to on that side of things?
Yeah. Maybe I'll start with the new features coming out.
Sure.
I never thought I'd be working for a technology company, right? I'm a clinician. This is what I do is clinical work. And being able to work somewhere where every 2 weeks we do a sprint and a push, and seeing like the app change all the time and make it more engaging and make the provider platform easier to use is so incredible to me. So we have a bunch of features coming out in this quarter, so Q2, where we're going to be having all of the documentation, time tracking, being able to use flags, a brand new client dashboard where you're able to sort and identify patients more quickly. So that care managers can do their job super effectively in these integrated models, all coming out by June. And that's going to make us the premier, what's known as a registry, the premier functional registry in the country. There's no question, bars down. The only other people right now really doing this are academic centers that have literally told us, like, we don't want to do this, right? So we know there's a lot of space here to make a product that people want to use and will be revolutionary.
Mm.
So I am incredibly excited about that. And that's not even like down the line. That's like a month away.
Wow.
In terms of like what I'm excited about is just being able to get on some whiteboards again and sketch things out with my team and talk about what the next few months will look like. I think there's certain things that remote just can't replace. And to me, that's like whiteboarding is one of those things where, just be able to sketch things out, talk things out. I am so excited for my first whiteboard session with my team, which will be in May. So like, I'm really excited about it. And then also just be able to travel again, like talk face to face with some of these healthcare administrators about what we're trying to do and show them like the outcomes and impact in person. Because I don't know about you, but when I'm on a Zoom call, I'm usually doing like two other things when I'm on the call. So like I'm checking my email, like I got Slack messages coming in. I think just having that conversation face to face across from a conference table, again, it's just like one of those things you really can't replace.
It's genuine, full on engagement, isn't it? It's not like sometimes you'll watch TV, but you're on your phone, you're listening to music at the same time. It's in the moment, I guess is what it is. So look, I 100% agree with that. I'm also looking forward to that sort of personal engagement. But look, Matt, it's been a pleasure having you on the show, giving us, all those insights. Sounds like there's some incredible sort of updates and things that you guys are going to be bringing out, as you say, not even massively down the line. Like we're talking, it's on the doorstep. So look, very exciting times for you, both personally and for NeuroFlow. In terms of anyone who wants to reach out to either hear about the platform, the app, you guys in general, what's the best way to reach out to you guys? I know that you have quite a few things I've looked on YouTube, various explainer videos, etc. But how's best to reach you?
Yeah, it's funny. I always say follow us on social media, not as like a shameless plug of seeing all of our blog posts and things, which are always great. But our social media is super fun. So particularly Instagram, which is NeuroFlow Live. Like we don't really talk about NeuroFlow as much as like we share some really cool like inspirational comics and just like talk about mental health. So I would check us out on all the social media platforms. Check out NeuroFlow or NeuroFlow Live, depending what it is. And I think the other way to kind of keep in touch with us is check out the website, neuroflow.com. And people can feel free to reach out to me too. It's Matthew at NeuroFlow, pretty easy one. And happy to kind of at least direct you in the right spot. But yeah, please follow us. I think there's some big news coming that I probably can't quite say on the podcast just yet. But there's always some things coming down the pike that I think are worth keeping a pulse on, especially if you're interested in this space of integrated behavioral health. Definitely.
Well, I'll share all of the links when the show goes out, and look, as you said again, exciting times ahead. So look, thanks again, Matt, for coming on the show.
Yeah, thanks, James. Appreciate you having me.
Good man.